Chicago health officials are warning residents about the spread of a dangerous illness. CDPH says there have now been 7 cases of meningococcal disease since January 15th. 2 patients, both adults, sadly have died from this infection. The disease is spread through direct contact with saliva and usually requires close and lengthy contact to spread. Symptoms include rash, high fever, and headache. So here now is Dr. David Wynn with Rush Hospital. You are an infectious disease doctor treating both adults and kids. Thank you so much for being with us.
Thanks for having me, Marissa. Yes.
Such an important warning to let folks know about. You know, we briefly touched on the symptoms, and they seem to start to look like something you'd get during a normal winter illness. When can things turn, and at what point do we look at this in terms of taking a couple of sick days to seeking medical attention?
Yeah, that's a great question, Marissa. Things can turn pretty quickly when we're talking about meningococcus. It can progress very quickly. So if you're feeling very ill, like to kind of mildly at first, it may turn more serious quickly, and that's when you definitely need to seek medical attention.
We've seen 2 adults be impacted here very seriously, sadly. What age group is most at risk for a serious case of this?
That's a good question. Probably young, the very young are at risk, and the very old are at risk as far as age groups go, but also people with certain medical conditions like immunocompromised may also be at risk.
Okay.
Yeah.
Okay. What's the best way to protect ourselves? I'm sure people at home are like, what is this thing that we need to be looking out for? How can people at home really look out to protect themselves?
Sure. So this is meningococcus is one of the bacterial meningitis causes. I think a lot of people may have heard of that. But this is, and there's a couple other bacteria that cause it, but this is definitely one of the more severe ones and moves pretty quickly, as I said. There is a vaccine for it. And we typically give it in the United States in adolescents.
Okay.
And that's kind of to make the kind of epidemiologic risk period of, teenagers. They may be getting more in close congregate settings, getting closer contact with other kids and stuff like that. And then college settings, for down the line, and even military. So those are the kind of settings. And so, at least 2 of these patients with the cases were in homeless shelters, as I understand it, and those are close congregate settings, so that would be a high-risk place. Yeah.
Okay. Yeah. So we're keeping in mind how this spreads, very close contact, as we mentioned. So something to be aware of as we head into the rest of the winter season.
Yes.
For sure. Dr. Wynn, thank you so much for sharing a little bit about this with us. So glad we can give folks at home a little bit of a heads up on this.